Tonight, we are talking about ableism, disability justice, and the toll that the COVID pandemic is taking on the disabled population, especially among communities of color. I am honored to have here with me tonight one of the foremost experts on disability rights policy and fierce justice advocate, Rebecca Cokley, who is the U.S. Disability Rights Program Officer at the Ford Foundation and one of my dear friends. I met Rebecca years ago when she was an appointee in the Obama administration. She's actually a three-time presidential appointee, y'all, having held several roles in the White House and beyond, driving a progressive policy agenda that protects the rights and services of disabled people and those that they depend on for survival. Rebecca, welcome to Amplified. I am so glad to have you here. And as you know, on this show, we talk a lot. Go ahead, girl, go ahead.
I was just going to say, it is so good to be here with you in your inaugural season of your show. I am so excited.
Oh my God, I appreciate you. So, as you know, on this show, we talk a lot about the personal side of politics. And this issue is oh so personal for you. So please start off by sharing a little bit about what drives you to do this work.
Honestly, it's a family legacy. Both of my parents were disability rights activists. My mom ran a center at a college that helped students get accommodations. My dad ran a center for independent living. But even more broadly than that, my parents inherited a legacy of everything that was the opposite of civil rights. My dad was the son of a federal segregationist judge in Selma, Alabama. And through, a friend of yours and mine, may he rest in power, Congressman John Lewis, in jail numerous times. And my parents raised me with the mentality that we had a fundamental responsibility to do better, to heal the tears in the justice system, to step up and to speak out when we saw people encountering injustice.
I really love that you have such an intersectional framework. I mean, obviously, your work in recent times has been very specific. You are doing disability rights policy, but you think about it in a broader framework of justice. And to me, that's so meaningful because coming from LGBTQ community, there was always this conversation about rights. And then, well, what does it mean to have intersectionality and to consider justice for all of the people that make up the community? So I would love for you to break down for us, people who aren't, in the nomenclature a lot. Talk to us about disability rights versus disability justice and why there's now kind of nomenclature to differentiate the two and why it's important.
The first thing I would say is the power of disability in general is how broad of a category it is. We're talking about a person with any sort of mental or physical impairment that impacts their activities of daily living. So while someone might look at me and see me as a person with dwarfism and say, well, obviously, your dwarfism is the thing that impacts you the most, it doesn't keep me in bed for 3 days like my migraines do. And so I think it's important to realize that the community that we're representing is way bigger than just the white dude on the wheelchair parking tag in a parking lot. It includes kids in Flint, Michigan, who are now almost 3,000 days out with clean drinking water, who've acquired learning disabilities. It includes women battling fibroids and being told that whatever sort of medical experiences they're having is all in their head. And it includes people living with long haul COVID now. The power of the community is that it's ever evolving and ever changing. And so for a certain period of the movement and for a certain group of leaders, disability rights was the focus. We could achieve equality through the court system, through remedying justice, through lawsuits and litigation and legislation. And then starting in the late 90s, early aughts, a crew of leaders got together, Mia Mingus, Stacey Milburn Park, Leroy Moore, and many others gathered and started thinking of the fact that this system didn't really work. And it wasn't encompassing the needs of a community that was significantly more diverse than the voices at the table. And came up with a disability justice framework, which includes roughly 10 principles, things like intersectionality, things like centering those that are the most impacted, thinking about how do we actually drive the kind of change that leads us to collective liberation versus fighting amongst ourselves for this metaphor of some pie that we're continually told we're fighting against our own people to get the smallest piece and to be, begging for scraps and being thankful for crumbs.
Mm. Oh my, yes, this whole fighting with each other to get the crumbs seems to permeate so many different movements, right? It's on and on and on. I'm glad that you started to bring up the connection point to people who, like you said, fibroids, who have medical issues that end up being a part of a community that maybe they didn't even know that they were ultimately a part of. The disability policy seems to be, at this point, so ubiquitous that we don't even really think much about it. There's so many different structural conveniences, I would say, or kind of openings that happen in accommodations for people, like you think, very simply like ramps everywhere versus just being stairs. But all of these things are a result of movement advocacy that this generation perhaps isn't even all that privy to. So for those of us who don't always think about these issues as foundational, perhaps, as they are to the way our healthcare system operates, the way we access just, going to the store. Give us your 1-minute elevator speech about why we should care about disability rights and justice.
We should care because the disability community exists disproportionately in every other marginalized community. If you're fighting for racial justice, people of color are more likely to be people with disabilities because of structural racism. If you are fighting for gender justice, people with disabilities are more likely to be diverse in a gendered way as a result of the violence and discrimination faced by people that are not cis, straight, hetero men. If you're fighting for economic justice, people with disabilities make up a majority of low-wage workers. People with disabilities live under a state of legalized, codified poverty in this country, where there's a group of our community that can still make as little as $2.15 a week and are not allowed to save money, or they're forced to lose their health care. 1/3 of GoFundMes are for an uninsured disability-related expense in this country. And so to me, it's one of those things that we will never achieve justice as long as people with disabilities are not at the table, because there'll always be a certain part of our community who we're fighting for that we are in fact leaving behind.
Hold on. I want to come back to something that you just said. So there are members of the community that actually are able to just be paid a sub wage. I don't even know that I would call that a wage, but $2 an hour. Talk to us about these maybe carve-outs and how that ends up happening.
As a result of phenomenal work done by FDR's administration, we get the Fair Labor Standards Act. And it did so many important things. It outlawed child labor. It talked about a 40-hour work week, all of these different things. But what it also codified was the creation of a program called 14C, or the SubMinimum Wage. And it said that there's a certain population of society that is so disabled that they can never be expected to achieve full mainstream employment. And so for those people, employers can bring them on as an act of charity and pay them less than minimum wage. The program itself, though, was intended and was actually legislated to be a temporary program, a program that somebody might join after first becoming disabled and learning how to re-enter the workplace. But less than 5% of workers ever transition to meaningful employment. We talk about waste and fraud and abuse in the federal government. To me, the fact that we have a program that's been held up by the federal government for decades now, that has less than a 5% achievement rate, is unacceptable and needs to change. And thankfully, we've continued to see legislators like Mr. Casey, like Senator Warren, and others actively push towards the elimination of the subminimum wage.
Oh, wow. So let's get into where we are currently with policy. So COVID is obviously hitting the community hard, and I would love for you to just, give us a quick overview of what's happening there. I'm particularly interested in how you think the Biden administration and certainly Congress are responding and reacting through current policy measures in response to COVID, Build Back Better, and otherwise to support people with disabilities.
The first thing that I would say, Aisha, is we saw this coming. One of the first things that the Trump administration did in March of 2017 was have a meeting with the nursing home lobby And they deregulated. What did they get rid of? Infection control standards. Prior to that, nursing homes were required to have an independent infection control expert at every nursing home. They were to only work in one nursing home at a time. They were to be an employer or an employee of that nursing home. And the first thing they did was get rid of that role and made it a contracted position and allowed people in that role to move from nursing home to nursing home to nursing home to have a multitude of clients. When you think about where COVID first broke out in this country, it was in nursing homes because the standards had been completely decimated by the Trump administration. And so when we in the disability community started hearing that there was this massive outbreak in nursing homes before it was, located or determined to be COVID, before there was even, rumors of where it came from or how it started, we knew where it started. It started in our community because we were vulnerable and forgotten about, and because of the demand for deregulation of these standards. And so we knew it was going to be really bad. And watching it go from there, we know that over a third of deaths came out of congregate settings, whether they be prisons and jails, psychiatric institutions, and nursing homes, all places with an abundance of disabled people in them. And I think as we've continued to watch what's happened, the biggest fight from day one has been to have a seat at the table. We've been so thankful for members of Congress who have continued to ride for us, who have continued to push the issues that we're facing. Allies in the community, folks like our friend David Johns and Dorian Warren and others who've continued to make sure that they're hyping the issues faced by our community at the tables that, frankly, a lot of folks have an intentional means of making sure we're not at.
Well, I wanted to have a whole conversation with you about how representation matters, and having that seat at the table is clearly a first step. So we're going to have you back. But thank you so much for being here. Rebecca Cokley, U.S. Disability Rights Program Officer at the Ford Foundation. Always appreciate talking to you and hearing your insights. We're going to have you back, okay? Thank you so much for being here.